All right. Thanks very much, Jim. I am going to talk about what we're doing about healthy transportation in Massachusetts, and there we go. And our commitment to healthy transportation at the Massachusetts Department of Transportation. So I'm going to go through a really boring chronology of laws and policies and put everybody to sleep after lunch. No, I won't do that. It's kind of a long laundry list of things, but I think what I'm going to try to do is, as I step through, show you how these different laws and policies sort of fit together to form a really strong foundation for promoting healthy transportation. But when looking back maybe 15 years ago or so, in Massachusetts, like in most or all other states, our Department of Transportation, or 20 years ago it was the Department of Public Works, probably fit the profile that Beth Osborne was talking about earlier of, very auto-focused, didn't want to hear about other modes, and, it's too dangerous to, nobody wants to ride a bike or walk, well, because it's too dangerous. And talking about the laws and policies, some from outside, some from inside the department, that have really changed that equation and changed how we build and operate our transportation system to make it really promote healthy transportation. Oops, sorry. And one of the really big early wins in this area was our Complete Streets design policy that was enshrined in our 2006 Project Development and Design Guide. As Beth Osborne talked about, the Green Book that has sort of national level design guidelines. Most states also have a state level design guide. And our old design guide was, very much like the Green Book and very, sort of numbers heavy and strict auto focus, whereas our 2006 Project Development and Design Guide really enshrined a design approach to accommodate all roadway users, pedestrians, bicyclists, public transit users, and motorists, and a design approach that says start your design from the outside of the road in. Start with thinking about the vulnerable users, the pedestrians, the bicyclists, the public transit riders that are getting on and off, and then the motorists. Does it always work out that way? No, but that's our official policy. And over the years, early on, did somebody, a project proponent from a city or town go into one of our district offices, and the district design engineer would go and take the old book off the shelf and pass the new Complete Streets Design Guide, pass it by. That happened, but that really doesn't happen anymore. We have made a lot of progress on really adopting and institutionalizing and internalizing these design standards. In 2008, the legislature passed the Global Warming Solutions Act, which called for economy-wide reductions in greenhouse gas emissions below 25% below 1990 levels by 2020 and 80% below 1990 levels by 2050. This had a lot of indirect effects on how we think about our transportation projects and really pushed projects that enable all different transportation modes and don't force the use of automobiles, really enable those to rise to the top. That was followed in 2009 by a very broad-based transportation reform law that consolidated all different transportation modal agencies, including 2 different highway agencies, as well as our Boston's transit agency, the MBTA, and our aeronautics and our registry of motor vehicles into a single consolidated agency under a strong secretary. And that has really, and it enabled a focus more on helping the customer to get where they want to go, and not just, you know, the highway agencies moving cars around and the transit agencies moving buses around. It's a much more unified and holistic approach. It enabled us to do things like bring the registry of motor vehicles together with the bicycle advocates that we work with at the Massachusetts Coalition for Biking, to talk about updating the driver's manual to include more on bicycle safety, and to put questions on the driver's licensing exam to focus on bicycle safety. The Transportation Reform Law also created the Healthy Transportation Compact, which is an interagency group that's co-chaired by the Secretary of Transportation and the Secretary of Health and Human Services to collaborate and focus on the health outcomes of transportation decision-making. And we have worked together a lot the efforts to promote health and transportation are supported by a number of different initiatives, including Health and Human Services Mass in Motion program that works with municipalities, wellness grants to municipalities, Leading by Example, which promotes the behavior of good behavior by state agencies to lead by example. Our Safe Routes to School is really a national leader, and I know that Rochelle's going to talk more about those kind of programs. Transportation enhancements and congestion mitigation and air quality, federal funding that we are using to promote healthy transportation, and our signature Green Dot policy, which established was sort of our part for fulfilling the requirements of the Clean Energy and Climate Plan, the Global Warming Solutions Act, and it's a broad-based, comprehensive policy to require the department to consider environment, triple bottom line in all of our operations and all of our policies. And it's guided by 3 primary goals: reduce greenhouse gas emissions, promote the healthy transportation modes of walking, biking, and public transit, and to support smart growth development. So it's putting the responsibility on us to actually promote these healthy transportation modes. We never call them alternative transportation modes, or we try not to. And it puts the responsibility on us to think about that land use piece. Some of the Green Dot initiatives that we've implemented over the years, we've held statewide bike weeks in May for the last 4 years, where promoting and building out a statewide shared use path network that's ultimately going to have 500 miles. I think we're about halfway there now. We've moved way up in the rankings that the League of American Bicyclists puts out each year for bicycle-friendly states. And just a year ago, the Secretary of Transportation announced the mode shift goal to triple the amount of travel by walking, bicycling, and public transit between 2012 and 2030. We also, as part of the requirements of the transportation reform legislation, we have instituted work on health impact assessment. We've had a pilot health impact assessment study done on a transportation study that we did of an old elevated highway that in Somerville, Massachusetts, right next to Boston and Cambridge. It's an eyesore. It divides neighborhoods. It's a barrier. It's unattractive. So we looked at a range of alternatives, looking at taking it down and replacing it with a surface street, and the health impact assessment really supported the findings of the transportation study that all of the alternatives that we were looking at would support improved public health. And we worked very closely with the Department of Public Health and Health and Human Services, and we had health impact partners come out and do a 2-day training for a lot of folks in our department and other departments and our consultants to learn more about health impact assessments. And this has all led up to something that has just come out it came out 10 days ago. It's dated September 9th. The MassDOT Healthy Transportation Policy Directive, signed by the Secretary, the Highway Division Administrator, the Rail and Transit Division Administrator, and General Manager of the MBTA, Aeronautics Division Administrator, and by the Director of Planning, that says all MassDOT projects must serve all travel modes. All projects that are funded or designed should promote the healthy modes, not just accommodate, but promote the healthy modes of walking, biking, and public transit for on-street and off-street facilities, and any projects that don't meet these standards require the Secretary's sign-off. Thank you.
Of the Cleveland City Planning Commission, and included in his work is encouraging sustainable communities and pushing, and he has spent a fair amount of time pushing the idea of the social determinants of health as a key element of creating sustainable communities. Thank you for being here.